I want to give everybody a chance to get their technology working. Give me your thumbs up when you're ready. I'm not seeing any thumbs up. Okay.
Sorry.
Good afternoon. My name is Matt Kelly. I'm health officer with Gallatin City County Health Department. Our main reason for calling this press availability today is to provide you all with an opportunity to make contact with some of the team that's working on our COVID-19 response on behalf of the people of Gallatin County. With us today, we have Dr. Eric Lowe from Bozeman Health, Sheriff Brian Gutkin from Gallatin County, Bozeman Police Chief Steve Crawford, Bozeman Fire Chief Josh Waldo, Bozeman School District Superintendent Bob Connors, and Belgrade Police Chief E.J. Clark. Also in the room are County Commissioner Don Seifert, Gallatin County Commissioner Don Seifert, our Communicable Disease Program Manager Cindy Spinelli from the Health Department, Buck Taylor from Community Health Partners and a member of the Gallatin City County Board of Health, Tracy Ellig, spokesperson for Montana State University, Eric Semerad, our Gallatin County Clerk and Recorder, Bozeman Mayor Chris Mell, Belgrade Mayor Russ Nelson, and I see others filtering in, and I apologize if I've missed anybody. As you all know, the situation surrounding COVID-19 is changing rapidly and continuously. You all also know that this is the first time the virus has impacted humans, and so we're learning every day about the virus, how it spreads, the best ways to slow down spread, and the best way to treat those who are infected. It's a complex and rapidly changing situation. But what I can tell residents of Gallatin County and visitors of Gallatin County is that we have an extraordinary team working across agencies, across organizations, and across political jurisdictions. Our team, some of whom I mentioned here today, includes healthcare providers, first responders, emergency managers, educators, higher education, and public health. And I can tell you we're also getting support and resources from elected officials across the board. There's no news to report related to cases in Montana today. I'm aware of no cases in Montana. As you know, there is one Montanan who has been diagnosed. That person hasn't been in Montana for several weeks. So I have no news to report to you that way. As health officer, I want people to know, though, that it's likely in the future that we will detect cases in Montana, and we're likely to detect cases in Gallatin County at some point in time. We don't know when. We've been preparing for that for weeks, and we continue to prepare. Our focus is on slowing down spread of this virus. We want to buy time for our healthcare system to continue to prepare, build supplies, and better understand the virus and how to treat people who contract the virus. Every day that we can slow down allows our healthcare system time and our public health system time to do this work. One of the things you may start to hear is flattening the curve. We know that we are likely to get cases. I heard before I stepped up here, we're one of 4 states remaining that has not identified a case. What we want to do, though, is we want to take actions that flatten the curve so we don't have the surge that kicks up and overwhelms our healthcare system. There's some things that we can do to slow down this virus by breaking the chain of transmission. That begins with something we can all do at no cost, taking care of ourselves. Washing our hands regularly, frequently, and thoroughly, eating well, getting sleep, and this is important, staying home if you're sick, particularly if you have a cough or fever. Staying well is good for you, but it's also good for our healthcare system and good for our community. We also want to talk to people about social distancing. It's important that we all think about our own health circumstances and the health of those with whom we live and work. If you have underlying health conditions that may make someone you care about more susceptible to serious illness, we recommend that you consider avoiding large crowds and places where you may be more likely to come in contact with somebody who has contracted the virus. We are not at this time mandating cancellations or closure of gatherings, but we are asking event coordinators to thoughtfully consider postponements or cancellations if possible, especially if the event brings together people in close quarters for a purpose that is not essential. We also want you to consider whether the event may attract those who are most at risk. People over the age of 60, people who have compromised immune systems, who have other underlying health conditions. Again, we are not mandating closures at this time, but we are prepared to help event organizers make tough decisions, and we urge individuals to make smart decisions for themselves and their families about the events they do attend. We're at a moment right now where we can flatten that curve. We can do that by social distancing and taking care of ourselves. The third thing I want to talk about today is really important during times of what perceived crisis and times of stress. We want people to be kind, and we want people not to panic. This is going to be a marathon, not a sprint. We're likely to see cases locally, though we don't know when. But there's some good news about this virus. First, most people who catch the virus will experience mild symptoms and recover fully. The other really good news, and maybe the best news I've heard in a month, is that children, for the most part, are not experiencing serious illness from this virus. If and when we detect cases locally, it is likely that we're going to have individuals who have been diagnosed that will be asked to quarantine in their homes. That means they'll be in your neighborhoods and they'll be in our communities. It is also likely that their household contacts will be asked to quarantine for up to 14 days. If this happens, we ask everyone in the community to respond with compassion, kindness, and charity in their heart. If you know someone affected, send them a text or an email, or give them a call. Ask them if they are doing okay, and consider dropping off supplies or food, but only if you can do that without face-to-face contact. There's also a couple areas where we need help from the community. One of the things that we're concerned about is places for quarantine for individuals who may not have a home or may be living in congregate settings. As I mentioned, most people who go into quarantine will be asked and have mild symptoms will be asked to stay at home to limit the spread of the disease. The health department is actively looking for places where we could provide quarantine or isolation to individuals or families who live in congregate settings or do not have a home available. The ideal site would be some place such as a hotel room or a house where someone could be comfortable for up to 14 days, have access to their own bathroom and sink, as well as communication with the outside world through computer or telephone. Again, we need some place where somebody can reasonably live for up to 14 days. We are not seeking people with guest rooms in their house or a spare bed in the basement. That's not what we're asking. But if you have access or control of a facility that might fit that description and have willingness to discuss making it available for this purpose, we ask you to call the health department at 582-3120, 582-3120. There's no major rush on this, anytime over the next couple of days. Another very common question, since we're on the eve of spring break, is travel. We're getting a lot of questions about travel, and we know many people are traveling for spring break. And we know they're going to come back to Gallatin County from many places in the U.S. and internationally. Here is our advice. For international travel, pay attention to the Centers for Disease Control advisories and follow their recommendations. There are countries in the world, and I'm not going to name them because they may have changed since I came up to this podium. There are countries in the world where they're recommending people not travel. Go to the CDC website and follow those recommendations. And it is important, make sure that you are prepared to quarantine yourself, to self-isolate when you return if that is necessary. Think about things you may need. Think about your prescriptions. Think about your supplies at home. We're not saying hoard supplies, but we're saying think about being prepared so when you do come back, you're prepared. For domestic travel, there's currently no formal guidance to stay away from any specific states or regions. But we would recommend that you be smart. Consider, are there confirmed COVID-19 cases where you are going? Can you take time off if you get sick or are exposed and need to be quarantined? Do you live with someone at high risk, or are you going to visit someone at high risk? And again, high risk, we're talking about people who are over the age of 60 or who have underlying health conditions. And finally, if you are already sick, please don't travel. Stay home, get well, take care of yourself, and self-isolate. With that, I'm going to turn it over to Dr. Eric Lowe from Bozeman Health, who has some remarks on behalf of that organization.
Thank you, Matt, and thank you to everyone else who's here and who's been a part of this response. My name is Eric Lowe. I'm a local emergency physician, and I'm also the medical director for the emergency department at Bozeman Health Deaconess Hospital. Bozeman Health is actively coordinating our communication, our preparedness, and our response activities for COVID-19. We're working with those around you and others in our response, and we formally activated our system-wide incident command structure all the way back on February 10th, 2020. Many people are aware that there was a near potential case at that point, and that gave us a jump on our preparedness. We are and we remain well prepared to care for any patient, and the safety and well-being of our employees, our medical teams, as well as our patients remains our highest priority. Since February 10th, the Bozeman Health COVID-19 response team has prepared and continues to prepare the health system for the possibility of local COVID-19 pandemic. This preparation includes, but is not limited to, development and planning for patient surge plans and alternate screening and testing sites, increased utilization of telehealth and B2 virtual care for patients and other community members, daily monitoring of supplies and purchasing of extra supplies as they become available, education and training of employees as the CDC guidelines are updated or modified for personal protective equipment, testing procedures, and patient care guidelines for those with respiratory illness. As Matt alluded to, this is a dynamic situation and things are changing rapidly, and so we're working hard to keep everyone updated as those changes occur. We're also preparing with daily communication to employees and medical staff of the current status and the goals of the incident command as those change. We understand that there's a lot of people who want or think that they should be tested for COVID-19, and currently we're following CDC and Gallatin City County Health Department guidelines for prioritizing those tests. I think all of us would want unlimited testing to use as much as we could, but unfortunately we do not have unlimited testing supplies, and we're prioritizing our testing to specific patient populations based on those recommended guidelines from those groups I mentioned. These guidelines too are rapidly changing as the situation progresses, but in general, the high-risk populations include populations who have appropriate symptoms of lower respiratory illness such as fever, cough, shortness of breath, and specific exposures such as travel to high-risk areas, exposure to a person with a confirmed case or a person under investigation directly for a case, or people with symptoms who match the disease and have symptoms severe enough to require hospitalization, or have other significant other medical illnesses that would put them at a very high-risk group. At this point, if you have mild to moderate symptoms of cough or cold, whatever the cause, whether it's this or another viral cause, we encourage you to stay home when you're sick to avoid the spread of any respiratory illness in our community. This is one of the best ways we can help others in our community. Do not go out in public until your symptoms have disappeared, and do not visit any medical facility unless your symptoms worsen and you truly need care. If you have non-respiratory illnesses or severe respiratory illness symptoms such as severe shortness of breath, please do still call your primary care provider or continue to access emergency care through the usual means you would use in a normal situation. If you are healthy, like Matt said, we encourage you to do what you can to remain healthy. Spend time outdoors, adhere to proper social distancing, eat healthy meals, and continue diligently washing your hands. Our top priority remains the health and safety and well-being of our patients, our community members, as well as all Bozeman Health employees and medical staff. Thank you.
I also want to say that we're currently planning with schools around the county, and Bob Connors from Bozeman School District is here and wanted to make a few remarks.
I want to make sure that we put to rest the rumors. Are we looking at extending the spring break? You know, everything's still on the table. It's a dynamic opportunity that is presented to us. We need to look at those things. We do have next week to work on those. Currently, as a staff, we are working on distance learning. We don't have the resources that the university system has. We are working with students 5 through 18. The university system is 18 and older. Those expectations aren't the same. We are, however, developing off-site learning modules that will allow our students to continue their education if we are put in a situation where there is school closure. I do not make that decision on school closure. That decision would come from Matt's department, or it would come from our school board. And so we're going to continue to update and continue to work with everybody as part of this group to make sure we have factual information and we base our decisions on factual information. The other thing that I would like to stress is our decision today is going to be based on the factual information we have today. It may change Monday. And so that why we need to be flexible. We need to be nimble in our responses. But rest assured, the school district is putting together modules in place so that we can answer a general situation and then work that down to a specific situation if something does occur. Thank you.
As health officer, I want to build on that a little bit. I want to make clear that we are not currently contemplating any widespread school closures. We are working with schools officials to prepare for the time when we might have a case associated with a school, and that may result in closures of individual schools, but we are nowhere near that right